flat face, you need a bit of projection. This kind of patient would not need to go crazy with what they need to spend or invest or their maintenance. But it's our job to give her the best advice. So for somebody like this, it's generally quite a straightforward clinical assessment. You need a lower budget needs to be spent on this, and actually you can get very nice beautification by enhancing the cheeks, bringing out the temples very subtly, and doing these very, very soft, fine-tuning treatments. But much like Philippe said, and I smiled again when he said this, somebody said, Patrick said, who do you like sculpting the most? Who do you take the most enjoyment from? And the people I take the most enjoyment from assessing and consulting are the 40s to 60s. Sort of mid-40s to mid-60s. Because those people, you can really make so much difference to the way they look, the way they feel, and the way they perceive non-surgical work. So I'm going to jump now, actually, further on to the 50s for a moment. So this kind of patient is often the kind of person that would walk into my room for a clinical assessment. And this kind of patient may, of course, be a surgical candidate in terms of, to give them best advice. I would often recommend that they consult a surgical colleague to assess their need. But if we were trying to get best result non-surgically, this is the kind of patient that might come in saying, I really can't afford very much. I'm looking at maybe a spend of X, maybe equivalent to 2 mils of filler. How do we get that patient thinking in a different way? My personal approach, and you'll see these guys do whole face approaches today, and we all know that is the best way to start strategically, to map out a treatment plan. The people, we lift the temples, we lift the compartments, we get this beautiful elevation. I speak very, very simplistically to patients to try and make them understand what we're trying to do. I would use different analogies. I would say, if you think about your face as being like, we've all heard this one, being like a house where we have to underpin the foundations, we have to lift with the deep level filler and then strategically place it, and then put the walls of the house up